the variety. You've got it all in health visiting, and there's never a dull moment, and there's always someone new to meet, and you're dealing with general public every day.
It's a real privilege to work with families and to have the respect and also the trust from families.
I can't imagine how I would have coped with everything I've had to deal with if she had not been in my life.
There's growing national and international evidence that the stage between birth and 3 years of age is the most important for a child's development and therefore for their future health and well-being in life. If we can recruit additional health visitors and start working in this new way with families, we can really make a difference to the lives of children in the East Midlands.
The health visitor's role is to work with families to really help children and families to be as well as they can be, and help parents to be the best parents they can possibly be, contributing to the well-being of whole communities. You must be a midwife or a nurse to do health visitor training. But the key skills for a health visitor really need to be excellent communication skills, a real passion to work with children and families and make a difference for them, to be flexible and adaptable to the needs of the local community that you work in, and to be able to respond quickly when people have problems.
The variety is what makes health visiting, and it's that dealing with the unexpected that we all love and we enjoy, and the kind of the fast pace of it. I think that with experience comes the kind of versatility. So one minute you are filling in a record of a family that you've just seen, the next minute you've got a mum on the phone that's crying because she's not feeling very well emotionally that day.
Health visitors lead teams of professionals, including nursery nurses, community nurses, children's centre workers and family workers, just to name a few, to deliver the Healthy Child programme to all families. And that includes a range of assessments from pregnancy right until the children will start school. Families come to us often as a first point of contact because they know us and they have a relationship with us, and often we've built up a trust with them. So they come to us when they have a need or a problem, and we can be a liaison and a point of contact for them. So we regularly meet with other professionals, for example midwives, school nurses, paediatricians, and then other agencies as well, so social services and education, police, a whole wide range of professionals who we would work with.
A good idea would be...
There's a lot of communication work for a health visitor. We'll spend lots of time on the phone to other professionals, responding to emails, writing records, keeping notes, all those sorts of things, which are all part of the role as well.
The main thing that I feel that I'm doing is I'm giving positive, healthy advice to promote healthier lifestyles for the parents and their children, and that we will sort of set a foundation for these families in the future so that they will become happy, healthier children, adolescents, adults and parents of the future.
It's made me feel a lot happier in myself with it, just being there and supporting me and come around talking to me, seeing I'm okay and everything like that, basically. It's been a great help.
As well as working with individual children and families, health visitors have a role to play in working within communities. So they have a role in knowing what services are within local communities, understanding what gaps there might be in services, and they'll work within groups such as children with disabilities or perhaps mums with postnatal depression. Health visitors will identify where there's needs and set up groups to meet those needs. This is such an exciting time to be a health visitor or to consider becoming a health visitor. We've got a national programme that is going to give us more health visitors and a bigger and more improved service going forward, and I think that's really exciting because we can make a real difference to children and families and therefore whole communities.